Did you know that peripheral artery disease affects over 200 million people worldwide and often presents first in the legs and feet? Early signs like leg pain or numbness are frequently mistaken for aging, delaying diagnosis and risking serious complications such as ulcers or amputations. Today, we uncover 5 warning signals you cannot ignore. Peripheral artery disease arises from atherosclerotic plaque narrowing leg arteries, impairing blood flow and causing tissue ischemia. Reduced perfusion triggers symptoms like intermediate calcification and a neuropathy leg before coronary disease appears. Early detection of these mechanisms, plaque buildup, endothelial dysfunction, and ischemic signaling guides timely interventions to restore circulation and prevent limb loss. Intermediate calcification, the hallmark PMID symptom, manifests as a cramping or aching pain in the calves, thighs, or buttocks during walking, often mistaken for arthritis or fatigue. Atherosclerotic narrowing reduces oxygen delivery, forcing muscle into anaerobic metabolism. Lactate accumulation stimulates pain fibers, presenting reproducible discomfort after consistent walking distance. Without intervention, pain-free distance often declined from several hundred to under 50 meters within months. Track your pain-free walking distance daily. Perform supervised exercise therapy such as treadmill or outdoor walking for 30 minutes at least 3 times per week, gradually increasing duration and the pace to build collateral circulation. Discuss interbrachial in this testing and the treatment if exercise is insufficient. Constant coldness or a decreasing pressure in the one or both feet, even in the warm environments, often goes unnoticed until advanced PMID stages reduce microvascular circulation. It indicates poor perfusion from arterial blockage and it precedes ulcer or gangrene. Atherosclerotic lesions and tibial reduce blood flow, improving thermoregulation. Skin temperature mapping studies show cooler food dorsum correlate with the PMID severity. Monitor food temperature daily. Perform wound socks or wear insulted socks. Elevate legs for 15 minutes twice daily to encourage blood flow and consult a vascular specialist to Doppler or ultrasound evaluation if coldness persists beyond 1 week. Persistent numbness, tingling, or burning sensation in the feet or toes, especially at the wrist or nighttime, often indicate nerve ischemia from poor arterial supply rather than diabetic neuropathy alone. Reduced perfusion deprives peripheral nerves of oxygen and nutrients, causing degeneration and demyelination. Electrophysiological studies show reduced conduction velocities in PMID patients, whereas controls the symptoms during notice onset, duration, and the triggers. Elevate legs periodically. Perform gentle foot exercise to promote microcirculation and consult a vascular specialist for nerve conduction and Doppler studies. Small cuts, blister, or a foot ulcers that fail to heal within 2 weeks indicate critical limb ischemia, severely reduced arterial blood flow, risking infection and gangrene. Ischemia tissue receives insufficient oxygen and nutrients for repair, impaired angiogenesis, fibroblast activity, and the neutrophil function delay granulation tissue formation and a wound closure. Ankle brachial index below 0.5 predict ulcer, healing failure. Inspect feet daily. Cleanse sources with a sterile saline. Apply non-adherent dressings. Keep veins elevated and seek prompt Vascular surgery consultation if no improvement within 7 days. Consider referral for a hyperbaric oxygen therapy for refractory ulcers to enhance oxygen delivery and support healing. Reduced or absent dorsal pedis and posterior tibial pulses detect on palpation are a clear sign of arterial obstruction and correlate with the PID severity, often preceding claudication symptoms. Atherosclerotic plaque decreases arterial lumen diameter and improves pulse wave transmission. Ultrasound and the pulse volume recording studies confirm lower pulse amplitudes in PID patients compared to healthy controls. Check foot pulses daily after resting supine. If fake or absence, schedule a vascular evaluation including ankle brachial index and a duplex ultrasound. Initiate antiplatelet therapy and supervise exercise within 2 weeks of diagnosis. Early detection allows risk factor modification and prevent progression to critical limb ischemia. Atherosclerosis, chronic endothelial injury from hypertension, hyperlipidemia, and smoking initiates oxidative modification of LDL particles, which accumulates in the isthma and trigger macrophages in infiltration and foam cell formation. Progressive plaque grows narrow peripheral arteries, impairs distal perfusion, and ultimately leads to critical limb ischemia in the legs and feet. Diabetic mellitus. Persistent hypoglycemia promotes formation of advanced glycogen end products that collapse cone in the vascular wall, activated inflammatory pathways, and impair endothelial nitric oxide synthesis activity, combined with microvascular rarefaction. This change worsens arterial stiffness and reduces lower limb blood flow, accelerating peripheral artery disease progression. Implement these habits to improve lower limb circulation and prevent complications. Consistency is key. Build these habits gradually to sustain improved circulation and prevent disease progression. Regular walking program. How to walk briskly for 30 minutes daily, at least 5 days weekly. Aim for moderate intensity that elicits mild leg discomfort, then stops. To build collateral muscles. Smoking cessation. How to utilize nicotine replacement or medications. Join support groups and set a quick date to eliminate a major PID risk factor. Healthy diet modification. How to adopt a Mediterranean-style diet rich in fruit, vegetables, whole grains, lean protein, and healthy fats. Limit processed meats and saturated fats to reduce plaque progression. By recognizing and addressing warning signs, intermediate claudication, persistent coldness, numbness or tingling, non-healing sores, and diminished foot pulses, we can detect PID early, take action to improve circulation and prevent severe complications. Combine symptom monitoring with a lifestyle change and a timely medical evaluation to protect your mobility and quality of life. If you found this video helpful, like it, subscribe, and share. Always consult healthcare professional if you experience these symptoms.